We do still have some people who are coming into BC and Canada from international travel who continue to test positive, including some temporary foreign workers and other Canadians who have returned home from countries like India, from the United States, and other countries around the world. This is a good representation of what is happening in the phase of the pandemic that we're in right now, and it shows us that in the last few weeks the virus is really spreading amongst younger people. So the top green line is people 20 to 29, and the line just below it is 30 to 39-year-olds, and that's where we've seen the dramatic increase in growth in the last few weeks. Having said that, in the last week, we've also seen increases in slightly older populations, including 40 to 49, and an increase in younger children as well, reflecting transmission that's happening in communities and homes. And this is a similar depiction of the proportions that we're seeing in different age groups as we've progressed in our pandemic here in British Columbia. And right now, the proportion of cases are in the largest proportion of cases in the dark purple are in young people between the ages of 20 to 29. And that's reflecting what we've been seeing over the past few weeks this summer that we've reported on. Many of these interactions are social interactions where it has been spread amongst social networks. And to help us understand a little better about those environments where exposure events are happening in the settings where people are being exposed and becoming infected with COVID-19, we've created this lovely series of figures that help us look at this by age group. So what we have is the percent along the y-axis, and along the bottom we have the age groups. So the x-axis tells us by different age groups. And what the different colors reflect is the proportion of those cases in that age group that are infected in different settings. And this is taking that big group of people that we know were infected locally, either through clusters or exposures. And it starts off with the dark red being household contact. So that's when it's transmitted between people in a family or a household setting. The lighter red-orange is community settings, and those would be things like some of the parties outside in the beaches or exposure events in the community. Then we have the orange being private parties or events, the yellow being restaurants, bars, lounges, the lighter green being workplaces, and there are a whole variety of workplaces over the past few months that we have had exposure events, including healthcare workplaces. We know there's been food processing plants. We've had some industrial camp outbreaks, mostly smaller ones, and we've had a whole series of outbreaks in other small workplaces that I'll talk about in a minute. And then, so those are, if we look at the top of this, there's 3 different time periods that we have depicted here. From January 1st to May 18th, that is the first part of our pandemic when we put in place those, when we were detecting cases and then put in place measures to reduce transmissions in our community, people staying home, not traveling, etc. And what we can see from that is there are very few settings where people are being exposed, and it's mostly for the younger people, exposures at home, and for older people, exposures in the healthcare setting. And of course, that reflects the fact that we had a lot of exposures in our long-term care homes early on. The second middle figure is May 19th to June 23rd. So that's as we started our restart here in British Columbia. And again, we can still see that there's a few more increased settings that are reflected here. But again, most exposures, particularly in young people, were at home, and in older people in long-term care and other settings. And finally, the bottom one is the one I want to focus on, because that's where we are right now. And this is where we can see what is happening right now, where we are seeing people being exposed. And these are the things that we've been looking at in terms of understanding what measures we can take to try and control the pandemic that we are in now. So this is just the bottom phase. This is where we have seen cases by exposure during phase 3. And really what stands out to me is that for young children and for older people, it is still the same. The most exposures events are in households. And so it's being transmitted from an adult who brings it into the household to children, for the most part. And in older adults, it really reflects, again, the transmission that we continue to have in long-term care homes. In the middle, though, what we're seeing is the differing settings that people can be exposed in now that we have started to open up different parts of our economy and of our society. So we see in the working age adults that there are exposure events that are happening in workplaces. And as I mentioned, these are a variety of workplaces. We've had large clusters in some workplaces like the poultry processing plants. We had other agricultural plants. We've also seen transmission between workers in settings from restaurants to fast food restaurants, warehouses, office settings. And in those places, the transmission has generally been between workers who either congregate together in their workplace without taking the precautions that they normally would take, or sometimes it is because they have the same social connections outside of the workplace, and then can bring it into the workplace, and there'd be one or two transmission events there. For the most part, what we have not seen is a lot of transmission in workplaces from workers to the public in many settings. The blue here, where we call other settings, it reflects things like gyms, other facilities that are open where there is contact with people that have led to transmission events. And in yellow, what we can see for particularly the younger adult ages, 20 to 49 in particular, we see clusters of cases that are related to restaurants, bars, and lounges, some of those being very high-profile ones that we've heard about in the last few weeks, as well as private parties and events. And then this should be no surprise, as we know we've been reporting on the Kelowna cluster, for example, which was associated with a variety of these settings. So these are not exact, but what they do tell us is that there's no one single measure that can make a difference in all of these settings. And the measures that we've been taking around increasing restrictions on what we need to do in restaurants, in bars, in nightclubs, the restrictions on people having larger parties for private parties and events, the restrictions on numbers in events, including the need for social distancing, for physical distancing, for having those other measures in place, are all continue to be important in terms of us stopping the transmission of this virus in our communities across BC. The other thing I wanted to focus on is a little bit about what we're talking about when we say we have community transmission. And so these are rates, the incident rates, so the number of new cases in the last week by health authority per population. And it's a measure that allows us to compare to, for example, other jurisdictions in Canada or the United States or around the world. So we've broken it down by health authority, and as you can see, in most of BC, our community transmission rates are very low. So if we look at the interior, Vancouver Island, less than 2 per 100,000 per population in those areas. It's a little bit higher in the north right now because we have a cluster of cases that was related to people coming back from a large religious event in Alberta. We have a focus, as we've been talking about, in the Lower Mainland, and rates in Vancouver Coastal and Fraser are in the vicinity of 15, 16 per 100,000. And if we put that into the context of some of the guidance that we've seen come out of Europe and the US, where the cutoff for being safe for things like full opening of schools and businesses, they use a measure of 25 per 100,000. And then we can see across BC, we are well below that. So when I talk about our community transmission rates being low, this is what we're talking about. And this is a very crude measure. It takes everybody and lumps them all in together. But what we can see is that it's even lower in school-age children, for example, and we can segment it out that way as well. But really, this is to tell us that we still are seeing this virus circulating in our community, but we are finding that balance of keeping that circulation as low as we can, and we need to continue to take measures to keep it that way as we move into the fall. I also wanted to, we've had an uptick in people in hospital, but as we've seen, it's mostly younger people right now who are being infected with this virus and passing it on amongst each other and amongst their social connections. And that is reflected in the fact that our hospitalizations still remain very low. And we know from the very beginning, one of the important considerations with this pandemic is making sure that we protect our healthcare system so it is there to provide needed health services to everybody, whether that's surgeries, whether that's people having motor vehicle crashes or breaking bones or having heart attacks. And we are monitoring that very carefully. We are also monitoring how many people are in our ICUs around the province. And again, that remains very low. And that remains at a manageable level. Having said that, we don't want these numbers to increase any further. These are comparisons that we've just updated from ones that we've shown before. So this is our cases per million here compared to a number of other jurisdictions and the rest of Canada. And as we can see, BC remains low. Same as we compare ourselves to other provinces, we have a slight uptick, but we are still very low. And this is also reflected in the numbers of deaths that we've seen in British Columbia. And really, this is a testament to the work that we have all done together to protect the most vulnerable in our communities, particularly our seniors and elders. And this is the comparison of what we have seen in BC compared to other provinces here in Canada. Finally, I do want to also talk about our lab testing. I mentioned that we've been doing the highest number of tests per day that we've done across this pandemic. And as you know, we are testing anybody with any symptoms right now in BC. So that's what we call high-risk testing. The pre-test probability right now, if you have any symptoms, that it will be COVID is higher than it was previously. And we're now doing about 4,000 to 5,000 tests a day, which is up about 10% from last week, and that's reflecting in the numbers that we're seeing this week. Our percent positivity, so for every 100 tests that's done, 2 of them are positive approximately. So that is also reassuring. It means that we are picking up people in our community who are positive, and that most of the people with symptoms don't have COVID. Our mean turnaround time for the test has gone up a little bit, and that reflects the fact that we're having more people going in per day for tests, and we've had some challenges in some parts of the province in terms of access to testing as well. But the lab capacity remains good, and we remain focused on increasing our potential, our capacity to test to a level that's much higher than this as we move into the fall. And we also want to talk a little bit about updating on the models that we've been using that helps us understand how the dynamics have been going here in British Columbia. And this is our mobility. We've seen this before. What it shows is that we are gradually coming back in the places that we are going, particularly retail, recreation facilities, grocery stores, pharmacies have gone back up to normal. We still remain below previous to the pandemic. Our rates around transit and workplaces, although that is steadily increasing as well. And I think happily we're still making use of the amazing parks and recreational outdoor spaces that we have in British Columbia. So some of that mobility data goes into this dynamic compartmental modeling, and that is our reproductive number. And as we can see, we've been bouncing around. We know we've had exposure events where there has been transmission to larger numbers of people, and that is pushes the R0 up. We've come down again with the measures that we've taken across the province, but this is it's a movable number, and partly that reflects the fact that we still have low numbers overall compared to the population in BC. But this is something that we are watching, because this gives us an idea of how well we're doing at stopping those chains of transmission. So it's the number about how many people I infect if I get sick. And this reflects the work that we're doing in public health to make sure that every single case, we identify all of your contacts and we make sure that you are no longer able to infect others, that you're aware of your risk and that you're staying away from others during the incubation period. This is an update as well of the scenarios that we have been updating as we go along over the last 8 presentations of this. So right now, we estimate that we're at that somewhere around 65% of normal, somewhere in between that 60% scenario and the 70% scenario. So we still have it in our hands, in our actions, to bend our curve back down. And that is what we need to focus on now. We're at that limit. We're at that precipice, if you will, where we need to take the actions to ensure that we can move forward into the fall and keep our curve low. Just a summary of this. Our model does show that there's a lot of variation. Part of that instability that we call it is because our rates are low. But it also illustrates the importance of reducing transmission from every single case. And that is the things that we all do together. So with COVID-19 in our province, we have continued to adapt our approach as we learn more about the virus and what we need to do to protect ourselves and those around us. But it also is important that we understand the impacts that the measures we've put in place have had as well. So what does this data tell us? It tells us that for the most part, in recent weeks, we've been able to find that balance, keeping essential services, businesses going, protecting our most vulnerable. It also tells us that as we prepare for the respiratory season ahead, we need to continue to work to break those chains of transmission as efficiently and as effectively as possible. And we all play a role in that. Our focus needs to be on keeping the balance, maintaining our vibrant, healthy communities, and keeping new cases low. Our well-being as a community, as a province, is about getting back to work, getting back into classrooms, keeping businesses going, and staying healthy. It's not an either-or situation. What we do need to do is pause those activities that we know are a high risk for all of us. And we've seen some of that in the past few weeks, especially spending time with groups of people that we don't know without taking personal precautions to prevent the spread of the virus. We simply have to look at the successes we have seen to show us what we need to do. Thousands of our restaurants have reopened. We know how important things like restaurants and corner stores and small businesses are to our well-being as a community. Millions of trees have been planted in BC this summer due to the effective safety plans that we had in place and people being able to go back to work. And many people have safely restarted recreational sports, community events, once again, just to name a few examples. But one way to think about your activities in the weeks ahead is to think about the numbers of contacts that you have. There's no magic number, but we know the fewer people, the better. And for some people, their own risk will mean that those numbers need to stay very small. So if you know you have more interactions ahead, for example, if you're returning to work, then you need to reduce your contacts in other areas. We need to find that personal balance, and that will mean a sacrifice for some of us in some areas of our life. We also know that different interactions require different precautions based on our risks and our personal circumstances. That's why we have this concept of a COVID-19 safety plan. We need it for every business, every organization in our province. And we should think about our own personal COVID safety plan for our family and how that looks and how that works. So if you're going back to work in an open plan office, for example, you need to stay within your team, that small number of people that you see every day, consistent number of people. The number of people, so you want to limit visitors. have visits with others virtually. Maintain your distance with those small number of people, but you may not have to always keep that 2-meter distance. 2 meters is better, but with people that you are, the same people that you're with on an ongoing basis, 1 meter is probably fine for most of your interactions. Recognizing the really important piece that we have to protect us all, which is staying home if we're ill ourselves. If your parents are helping to care for your children, then you will have to consider things like spending less time with friends outside of your household or your family. Because grandparents, we know, are more vulnerable to severe illness, and we need to keep those external circles small. If you're starting university this fall, most of your classes will be online for now, but help to keep the university and your community safe by avoiding in-person social events with large groups of people. Keep your close contacts small. And of course, no matter who you are or what you may be doing, staying home when you're feeling even slightly ill is a requirement for all of us. And if you have symptoms of COVID-19, you need to be tested. We know that giving people the space to stay safe is very important for all of us. For the first few months, we spent a lot of time in this pandemic talking about giving 2 meters between people outside our bubbles. And we've talked about the importance of wearing masks when you can't maintain that. 2 meters is the ideal, we know, for uncontrolled environments, particularly with people we don't know. But 1 meter is also good if you're with the same group of people you know and see regularly, such as work colleagues, classmates, for example. The distance can be less because these are controlled situations where we have the same people, where we have a limited number of people that we are actually in that environment with on an ongoing period of time. And we've seen this work in some of the COVID safety plans that we've had, for example, with pods of workers who travel together to a workplace. And this is how we control the spread, but also we keep each other safe by making sure that we're not having contacts that are unsafe with lots of people. Close face-to-face contact for extended periods of time with anyone outside your household bubble should be avoided. So those are the things that we know are riskier when we're having conversations, whether it's inside or outside, inside being riskier in parties and events where we're singing, when we're hugging, when we're close to people, when we're eating and drinking together. And that can be things like having staff get together in a staff room, for example, or having coffee. We have seen this virus transmit in those ways. So those are the things that are riskier than sitting together in an office environment or even having a meeting when we're at a distance from each other. If close-to-close contact is unavoidable, then wear a mask. I understand this is not straightforward, and it's very challenging for us to think about our own situations. And it's different than it was at the start of the pandemic because we need to continue to for the well-being of our community, to keep things moving. But it is helpful to remember that as we move into different environments, the basics stay the same. I do also want to remind people that being outside is less risky than inside. And if we're just walking by somebody on the street, that is not a risk for transmission of this virus. So we need to make sure that we are okay with that type of outside environment, that it's fine to go outside. It's okay to avoid physical contact on a playground. We've seen that work very effectively where we don't see transmission between children, and we just remind them and teach them not to touch each other versus staying that 2 meters apart. Those are the types of risk assessments we can do for ourselves on an ongoing basis. So we are keeping a fine balance, but it is at the edge. And it's because most people are taking the precautions that we know work. And because of the work of public health and contact tracing and in finding people who have been exposed so that we can stop those chains of transmission. Now we have the choice. As we are moving into the fall, where we know more people are going back to work, we know children will be going back to schools, we know the respiratory season is coming, we need to all continue to make those choices that keep our communities, our elders, our loved ones, and ourselves safe. And this weekend in particular, choose to go small. Choose to spend time with your household bubble instead of a group of strangers. And choose to use those layers of protection wherever you may go. Let's make sure this Labor Day long weekend we are united in our singular focus to continue to stop those chains of transmission and bring our curve back down. And of course, let's continue to do this by being kind, being calm, and being safe. Thank you.